I'm Dr. Anthony Colantonio, Medical Director of the Clinic for Specialty Pain Services at Meadville Medical Center. You have been referred for an injection in your lower back, otherwise known as the lumbar spine. The injection is called an epidural injection since the medication is injected to a space immediately behind the spinal cord, and that space is called the epidural space. The space is located underneath the bone of the spine and just above a fluid column that surrounds the spinal cord. The injection contains steroid and is intended to reduce the inflammation around your spinal cord, inflammation that is contributing to your pain and your symptoms. There is no permanent structural change to your anatomy as a result of this injection. Therefore, it is expected that results will be temporary. The results can last anywhere between several weeks or up to several months. The longer the benefit from the first treatment, the better the prognosis that occasional injection therapy will be adequate for your treatment. Otherwise, you will need to discuss surgical options with your other doctors or consider chronic use of non-narcotic prescription medications. The epidural injection is performed under X-ray to increase the accuracy and safety of the injection. You will lay in a face-down position for the injection, and it will take between 10 and 15 minutes to complete. You'll be laying in a position such as represented by this spine model, where your head is up here, tailbone is down here. Under X-ray, I'm able to visualize a space between the bone structure of the spine so we can place our needle and advance it to the epidural space to complete the injection. If you have significant anxiety about procedures, you can ask about the option for conscious sedation. The risks of the injection include bleeding, infection, and dural puncture. These are all very rare. Bleeding is unlikely to occur unless you are routinely taking blood thinners. If necessary, we will instruct you on how to adjust such medications before the epidural injection so we minimize bleeding risk. Infection is also extremely rare. It is very important to note that if you have or develop any infection or illness between this appointment and your scheduled injection, that you inform our office of that situation right away. In that case, your epidural injection will need to be rescheduled. It would not be safe to perform a spinal injection in the setting of active infection. Dural puncture may occur during these epidural injections. The dura is the name of the covering over the spinal fluid column. This dura is actually intentionally pierced during a spinal tap procedure when the purpose is to draw spinal fluid for testing. For epidural injections, the intent is not to go through the dura and access any of that spinal fluid. However, because of the very close relationship between the epidural space and the dura, it is possible to pierce the dura during an epidural injection. If this happens, it will heal on its own. The dura heals just like skin, and the hole created by the needle would close within a few days on its own. During that time, while the hole is there can be a slow leak of some spinal fluid, and this could cause a condition known as a spinal headache. Typically, the headache is treated conservatively with Tylenol, adequate fluid intake, and bed rest. The headache is more severe when upright, and it is usually greatly relieved when laying flat. It can take up to 3 or 5 days for the headache to resolve. Alternatively, a more aggressive treatment for a spinal headache would be to perform a procedure called an epidural blood patch. For this procedure, your own blood would be drawn and then injected to the epidural space where the hole is in the dura. Performing the blood patch does carry the risk of another dural puncture, so this is usually reserved for treatment if conservative measures fail. There are some general risks regarding steroid that you should be aware of. One of these risks is that steroid can have a negative effect on bone density. If you have osteopenia or osteoporosis, steroid exposure could have further negative impact on these conditions, especially if steroid-containing injections are repeated over numerous times for you. A single injection is unlikely to result in any significant effect on osteopenia or osteoporosis. However, there would be concern in the setting of multiple repeated injections with steroid. It is therefore important to let us know if you are currently receiving or expect to receive steroid-containing injections at other clinics from other physicians. Another issue associated with steroid exposure has to do with the concern for the adrenal glands. These glands naturally make steroid in our body on a daily basis. Our natural steroid is called cortisol. If you are receiving steroid injections on a frequent basis, it is possible that these glands will shut down, and this could cause a medical condition known as adrenal insufficiency. Finally, it is very common for blood sugar levels to increase after a steroid injection. This is of particular importance for our diabetic patients. The general medical recommendation is that daily blood sugar levels average 150 or below before proceeding with safe exposure to steroid-containing injections. Baseline blood sugar levels will be elevated and may double or greater for up to a week after the steroid injection. This may require diabetic patients to adjust insulin dosing if you are already prescribed insulin, and at a minimum, be very cautious with your dietary intake for the week after the steroid injection. If we decide to proceed with your epidural injection, it is advised that you have a follow-up appointment scheduled with your referring physician around 4 weeks after the injection. This is an appropriate point in time to evaluate the response to the initial treatment. Decisions about additional injections or other treatment options, including possible surgery, will be addressed during that appointment. Onset of relief from the epidural injection averages 3 to 5 days from the procedure.